Auzubillahiminash-shaytanir-rajim. Bismillahir-Rahmanir-Rahim. CME update by Mother and Child Survival Group of Pakistan. Me, Dr.Tariq, Ops Gynae Family Emergency Specialist, Internist, Gulf KSA, presently District Gynecologist. Topic of CME I already touched. It was subfertility. Female subfertility we have discussed. We'll review briefly, but today's topic is male subfertility. The male subfertility trends are also increasing, and it is about accountable for about 20 to 25% of the subfertility, in which the male factor is the most important one. And the investigation should start after 1 year. It could be started earlier if there is obstructed problem, if there is some genital cancer, is testicular cancer, and if there is some ejaculation problem. The most important thing for male factor to be successful is the normal spermatogenesis, and then the erection, and then ejaculation. So these are the three factors which are most important, and it should be considered seriously. Then the increasing in the male declining of the sperm concentration is not the global issue of fecundity, but it is also related to orchitis, hypospadias, and genital cancer, and it's all related to testicular genital genesis syndrome. So normal male fertility depends upon spermatogenesis and erectile function and ejaculation. The WHO criteria for normal sperm is volume is 1.5 ml, and count is 14 million is to 10 is to 4, and progressive mortality is greater than 32, and total mortality is greater than 40. Now we have to have the investigations. The most important investigations are ultrasound of the testes, genital KUP, abdomen also, and then the FSH, LH, and testosterone, and then we have to see the CBVAD, congenital absence of vas difference, and important is testosterone as well. Now, what is the treatment? Most important treatment is the lifestyle medication. To reduce the smoking, stop smoking, reduce smoking, and reduce alcohol intake, and stop the use of these recreational drugs. Then regular exercise, healthy diet, increase in water, avoid stress leads to distress, to disease, to depression, to disasters and diseases. Best anti-stress is the prayers and the recitation of holy books like Holy Quran. And then exercise is the most important one, healthy lifestyle, and reduce intake of all these smoking, alcohol, and recreational drugs. Now we have to FSH is elevated in testicular failure. So now we have to review the medications. Anti-spermatogenic, these includes the anabolic steroids, sulfasalazine, and alcohol. And anti-androgenic, this includes cimetidine and spironolactone. And the others are ejaculate for ejaculation for ejaculatory failures, and others antidepressants, and this beta blockers, and metoclopramide and others. And then for ejaculatory failure, this drug imipramine is used. It's also to be reviewed. And then surgical, we have to sort it out to relieve the obstruction and to reverse the testicular vasectomy. And but as the varicocele does not improve the pregnancy rate, so it is not indicated. And then in the urine, post-orgasmic sperm retrieval in retrograde ejaculation, and also surgical retrieval from the testes, if the more than 50% success if the 20 that is FSH is normal. Then we have these issues like artificial reproductive techniques, IVF, ICSI, then IVF, ICSI, and this donor insemination and adoption. What is the pathogenesis of the male subfertility? This includes, number one is the sperm abnormalities, 85%, and then comes the immunological 5%, and then coital dysfunction 5%, and others also 5%. The spermatogenesis, this includes sperm abnormalities, spermatogenesis, OAT, oligoasthenostetospermia. As I also the azoospermia is complete absence of sperms in the ejaculate, and oligospermia is the reduced number of sperms. So this sperm dysfunction, this includes genetic, drugs like alcohol and nicotine, and then genital cancers, and then this hypospadias. And then comes the other causes, immunological causes. These are infections, idiopathic, and then this cryptorchidism, orchitis, chemoradiotherapy issues in the testes. And then the these are the, and then coital dysfunction. These include ejaculation, retrograde ejaculations, and ejaculatory failure, and it's all due to retrograde ejaculation in diabetes and in the bladder neck surgery, and hypospadias, and then complete erectile problem and others, they are also included. And then ejaculatory failures also in multiple sclerosis and others. So then others pathological factors are also mentioned. I have mentioned that it is genetic hypergonadotrophic hypogonadism, and cryptorchidism, and these chlamydia, gonorrhea, and these cryptorchidism, orchitis, and these are one of the few abnormalities which affects the male subfertility. As I have told you that FSH and testosterone are needed for investigations, and then the picture has to be seen in the whole subcontext, in the whole picture of subfertility between women and men should be seen together first, and then if needed a lone sensitive question can be asked from the couple. So this after this in all male or female fertility, I have mentioned already that healthy lifestyle is also very important. As for the female fertility and others, the important things are that there is tubal factor, there is anovulation, there is endometriosis, and there is unexplained infertility, and there is male factor, and the male factor is 20 to 20%. And similarly, the other factors are also important. This unexplained infertility also 20 to 20. And then for the investigations, FSLH hormonal profile, FSH, LH, TSH, prolactin, and testosterone, estradiol, and day 21 progesterone is also very important. It should be greater than 30. And then basal body temperature, and then stereosulfonography for tubal patency, laparoscopy gold standard both for diagnostic and prophylactic and therapeutic for the lysis of the adhesions, and for the microsurgery, and for the tubal, and for the excision of these endometriomas. And then saline cosine also important for the this tubal infertility, tubal patency. Treatment, as I have mentioned, the healthy lifestyle, exercise, good diet, healthy diet, avoidance of stress, and folic acid, and these all protocols, ovulation stimulation protocols, and to treat the PCOD and hyperandrogenism, and for that we have to have all these PCOD cases, ovulation induction with the clomiphene citrate, and with the GnRH analogs, and both these protocols are advised. And then are the GnRH analogs, and then are the ovarian diathermy and ovarian electrocautery, and in PCODs, and for drilling, and for stimulating the ovaries in subfertility cases laparoscopically. And then insulin sensitizer, reduce of the weight, reduce of the BMI. Normal BMI is a very important age, as also I have mentioned also, and there's after 35 defect this is reduced. And then GnRH analog for the ovulation protocols, and insulin sensitizer, metformin and clomiphene can also be added. Clomiphene is basically anti-estrogen, but limited cycles are allowed, and it leads to ovarian hyperstimulation syndrome. And then other causes, then they also, if all these are failure, like endometriosis moderate to severe, and then these unexplained infertility and tubal factors and others, then these IVF, ICSI, and other PGT, implantation, diagnosis, donor insemination, and surrogacy. So we will come with another review, and with this we finish our review. For a next review, and takeaway messages: pray, praise, trust, love, trust Allah always, and follow Suesna, the lifestyle of Hazrat Muhammad sallallahu alaihi wasallam, our health and survival, and दो नीम इनकी ठोकर से सहरा और दरिया, सिमट कर पहाड़ इनकी हैबत से राई. We must not forget our glorious past, and then always ask and pray, praise, trust Allah. हम तो माइल बकरम में कोई साइल ही नहीं, एंड राह किसे दिखलाए राहबर मंजिल नहीं. देन वी कम वकफ़ा बिल्लाह वकीला, वकफ़ा बिल्लाह नसीरा, हस्बुल्लाह नेमुल वकील, वकफ़ा बिल्लाह वकीला. और अल्लाहुम्मा ज़िक्रक शुक्रक हुस्न इबादतक, अला व ज़िक्रिल्लाह व तत्मईन क़ुलूब, अल्लाहुम्मा अज्जिरना मिनन नार. So we'll come with best of luck for the patients listening. Goodbye and salam alaikum and best of luck. Wama alaina illal balagh. Thank you very much.